many dentists in America still don't understand. To help heal cavities, to reverse cavities, and even to help heal gum disease. It's continuous praise for this tiny little mint. Xylitol is such a precious, unbelievable resource we have. Use it. I believe it's a gift for us to have healthy mouth, healthy teeth, and especially as we age. You've probably heard how important mouth health is. And if you want to have mouth health, you don't have to spend thousands of dollars going to dental treatments. What you need is one little delicious mint. Mouth health is complex, and yet it's easy. And unfortunately, most people don't know how easy it can be. The easiest way to have mouth health is actually to have very healthy baby teeth. And back in the 1970s, we did some studies. We, wasn't me, but friends of mine did these studies where they gave pregnant women some xylitol. Now, xylitol is a delicious sugar. It's used in baking in diabetic circles, but it also has been used for decades and decades as a tiny little breath mint. In Finland, it's also used as chewing gum, coated on the outside of chewing gum, as a candy that's safe for teeth. So I was living in Europe in the 1970s, and these studies were being done on pregnant women, or with pregnant women, who were consuming some xylitol for 3 months before the baby was born and then for a year after the baby was born. And what they discovered was that it changed these women's mouths. And the outcome of that was that they had such healthy mouths that was transferred to their babies. It actually was a simple transfer of bacteria. They didn't know at the time, we didn't know in 1970 why, we just knew that happened. And that children by age 6 had as much as 92% less cavities if their mothers had healthy mouths when they were born. Now, we can add to this all the studies that then happened in the 1970s, looking at xylitol, giving it to young children. And in Finland, they began a program that is now over 60 years, where preschool children are given xylitol gum as they get into school. They chew it up, spit it out, sit down in class. And that's how they enter school. They do that after lunch, and then they do it before they go home. When I came to America, I was the clinic director at the pediatric clinic at the University of Rochester. And the children, this was a fluoridated community, and yet these children had so much tooth decay. It was tragic. It was an awful thing to witness, the amount of tooth decay in these young children under the age of 10. And because I knew about the wonderful studies that had been done, the reduction in tooth decay with the use of xylitol, it seemed obvious to me to do a study where we would give these pregnant mothers in Rochester xylitol and then monitor the growth and development of their children as they grew. I couldn't get funding for my study year after year after year. And eventually, when I asked the question, well, how do I get this funding? What am I going to do about it? I was told that nobody would ever fund something like that because it didn't make any money for anybody. And that made me so angry and disappointed and depressed that the profession that I had been working in for 20 years had no interest in the simple solution to tooth decay. I decided I would no longer work at the University of Rochester, and I took my money from my retirement fund, and I started a company in the late 1990s. I started to make a xylitol mint. And that mint was 100% xylitol. It was quick dissolving. And the team of people who began using it to see the effect were actually waiters in a restaurant. That's a whole nother story. But it was in this restaurant that I had seen waiters smoking cigarettes, snacking on cookies, drinking coffee and soda, and then eating an Altoid mint. And I told them if they changed that Altoid mint, which was a sugar ball, Or if it's a non-sweet one, it's probably a sorbitol ball, which is equally dangerous for your mouth health. If we switch that out for 100% pure xylitol mint, things would change in their mouths. And so I made for these waiters these little 100% xylitol mints that tasted just like an Altoid. So yes, I started a xylitol company 20 plus years ago. And it was to initially for me, for my family. I couldn't find any xylitol anywhere in America. And I was aware how useful it was for stopping children getting decay in their teeth. It was able to prevent cavities in children. And I had children at that point. They were preschoolers. They had gone through preschool. Some were older. And so these mints were basically made for myself, my family, my patients, my friends, and these employees in this restaurant. And what they discovered, these were people who really didn't care that much about their teeth. But they started carrying these mints around. They would take them in the car. They would have a few before bed at night if they didn't have time to clean their teeth. They would nibble on them throughout the day. And they discovered the most amazing change in their oral health. This is the new part of the xylitol story that many dentists in America still don't understand. The incredible way that xylitol works in an adult mouth to help heal cavities, to reverse cavities, and even to help heal gum disease. And you can be waving at me from the other side of this video saying, oh, show me the studies, show me. It's the same today. To get a study done on xylitol to show its benefits and how it could wipe out the need for dental cleanings or the need for a lot of fillings, it's impossible to have that funded. Nobody wants to pay for that. That's why it's always interesting when there's a xylitol study, you really need to know who's funding it. Because usually the funding will tell you what the purpose of the study was. There was a study some while ago showing erythretol was better than xylitol. Well, guess who funded it? The company that owned erythretol. What we know today about xylitol is it's really good for gut health. When you consume xylitol, it's a prebiotic. It feeds the good bacteria in your mouth, but it also, when you swallow it and it goes into your digestive tract, it actually feeds the good bacteria in your digestive tract that produce a product that's, or a material that's now being better understood. Finally, I'm hearing lots of people talk about butyrate. And butyrate, which is in butter, it's in certain vegetables and fruits, butyrate is really good for your digestive lining of your digestive tract. It is almost like the sort of glue that holds the lining of your digestive tract together so that it stays healthy, that it's protected, kind of like it does in the mouth. Xylitol feeds the good bacteria that form this biofilm that is a thin film that protects not only your teeth, but your gums and the skin of your mouth. So xylitol is really good for feeding the good bacteria in your gut and your mouth. It's really good for stimulating a flow of saliva into your mouth. That's the reason I recommend it at the end of meals. So the way to use xylitol is to have 1 or 2 mints at the end of a meal, after you've had your meal completed, eat, drink, finish, have your xylitol. And what it is, it's hygroscopic. It actually has a pull. That's the nature of xylitol. This particular property, hygroscopic, it's pulling, it wants water to come to itself. And if you've got the mint in the middle of your mouth, it's going to come from the salivary glands that are in the roof of your mouth and on the sides of your mouth. And so all of a sudden, if you think about it for a second, your mouth is now moist with saliva. And that saliva is dripping with minerals. It is super saturated. It's absolutely laden with the very minerals, the hydroxyapetite minerals, that some people spend $25 buying special toothpaste to get those minerals. They're there for you in your own saliva. And what's special about the ones in your saliva, they know how to go into your teeth. That's because they're the naturally produced ones, and they naturally go into your teeth to repair, to remineralize, to make your teeth less sensitive, to help build your enamel, to make your enamel whiter, smoother, shinier, healthier. You know, all you have to do is just run your tongue over your teeth after you've had some xylitol. And immediately you know your mouth is fresher and smoother and happier. That's how many people describe it. If you do that, you don't want to eat or drink now for an hour afterwards, because this repair work is going to go on. The saliva in your mouth is going to keep putting minerals back into your teeth for that hour. If you have sensitive teeth, you don't need sensitive toothpaste. You need this hour of mouth resting. Rest it after the xylitol. Just like when you build up the bones and muscles by doing weights in the gym. You can't do that every single day, all the time, really, really heavy weights, or you'll break down your muscles and damage yourself. But if you rest, they rest and repair, and that is the same process in your mouth. Eat and drink and have a happy time at your meals, end with xylitol, and then mouth rest. Ideally for 2 hours or an hour and a half, so that not only will the xylitol help to strengthen your teeth, feed the good bacteria in your mouth, but you'll also get some benefit from the production of nitric oxide, which, if you know anything about it, it helps your heart, your breathing, and your cognitive, your thinking of your brain. The other thing that xylitol does is it actually has a very interesting interaction with plaque, or the bad bacteria, the infected biofilm in your mouth. What happens is the plaque bacteria love sugar. That's what they normally feed on. If you are eating a snacky, sugary, carbohydrate diet, these bacteria are just happy place, because they take the sugar, they break it down, they grow, they multiply, they thicken, they produce acids as they grow, and those acids damage your teeth, open up holes, and into those holes these bacteria will travel, where they multiply and destroy your teeth. If you feed them xylitol at the end of the meal, and once they've soaked it up is when they, if they were people, they would realize they can't use it. It's the wrong shape. You see, xylitol is a 5-carbon molecule. Other sugar alcohols, do you remember I said sorbitol was almost as bad as sugar? If you consume a lot of it. It's okay just in toothpaste, just in mouthwash, you're not consuming it. But if you keep consuming sorbitol as a non-sugar sweetener, it feeds plaque. Plaque can use it because it's a 6-carbon. I can't make a 6-carbon shape with 5 fingers, but imagine this is my 6-carbon shape. Xylitol is only 5. It's a different shape. And the bacteria of plaque require this shape, the 6-carbon, in order to grow and multiply. When they've absorbed xylitol, they're done. They have no energy. They can't reproduce. They can't damage your teeth anymore. They can't even make the sticky stuff that attaches them to your teeth. They're going to be slippery. They're going to fall off the next time you clean your teeth. They're going to get brushed away if you have a halfway decent toothbrush. Not if you're brushing with a super soft brush, but get yourself one of the ones I recommend. The mouthwashes is great. Brush away. Don't be scared to brush your teeth. And you will brush this plaque, this non-functioning plaque, off your teeth. And your teeth will sparkle. Your gums will be healthy. And maybe you don't even need dental cleanings anymore. This is what I've done. I've done this now for 40 years. And my gums are healthy. My teeth are healthy and clean. They stay strong. It's just a pattern of eating and drinking and using this small little mint made out of 100% xylitol. They're actually an oral health supplement. They don't contain glycerin or glycerol. Because glycerin, when I was learning dentistry in the 60s and 70s, there was a chemist who was sure that glycerin was going to stop remineralization. You remember that putting back of minerals into teeth that we just talked about? Glycerin may interfere with that, and that would be a shame. So I made chewing gum without glycerin, which is virtually unheard of. And I did it at my own cost if, while we were making it, the machinery got glued up, because that's what they believe today. I had actually asked an old gum maker who had made gum back in the day, if this is necessary, do you have to use glycerin in chewing gum? And he told me, no, you don't. He said I'd be fine. I was a little nervous the day we ran the first batch, but our chewing gum is made without glycerin for this reason. I don't want to interfere with the mineralization. If that's the only gum you can get, don't worry. It's better without, but if you've got it, you've got it, and hopefully you'll still have the benefits of xylitol in lots of other ways. Now, the final thing is, if you're chewing gum, don't chew it for too long. The benefit of xylitol is immediate. As I mentioned, it is in your mouth. It has this hygroscopic pull. It happens within the first 2 to 10 minutes. After 10 minutes, if you keep chewing and chewing and chewing, the problem is you are now creating a flow of saliva into your mouth that is different. It's coming from the glands that are in here, in your cheeks, and they get squished by your chewing muscles. And your body is thinking, oh my goodness, you've got something stuck in your mouth. You keep chewing. I need to dissolve this. I need to help you digest it. And so out of this gland, your body is going to pump digestive enzymes, things to break down this thing that it thinks you can't get rid of. When you keep chewing and chewing gum, you are actually probably not doing your teeth much of a favor, because the digestive breakdown liquid that your mouth is producing for you is very thin. It's not full of those minerals. It's not feeding the bacteria. It's washing everything away. It's trying to clear your mouth and digest things. So if you get ulcerations or ulcers, or you have stomach reflux, acid reflux, that may be because you're chewing and chewing and chewing on chewing gum for too long. Just like they did in the preschools, chew your gum 2 to 10 minutes, quick is fine, get rid of the flavor, throw it away. Then you begin mouth resting, just like the people who are eating the mints. It really doesn't matter between mints or gum. The effect is the same. The effect is not from the chewing, it is from the xylitol. And the xylitol is such a precious, unbelievable resource we have. Use it. Use it young, use it in the children. I'm delighted to report that I have 8 grandchildren now as teenagers, and not a cavity anywhere between any of them. They have virtually not had a cleaning in all these years. And my own kids too. And my family, my friends, the people who get on this program. It's continuous praise for this tiny little mint made with 100% xylitol. Comes from the wood of birch trees and plant-based. It's so easy and so good. And for anyone who's nervous, our own bodies. We have 15 grams of it made by our own bodies, xylitol, every day. Why does it make it? To stabilize our blood glucose. It's so good for us. You can achieve the same results if you go to a health food store and buy the granular xylitol, but the quantity is tiny. You would be aiming for about a teaspoon, 1 to 2 teaspoons a day, split into 5 or 6 smaller amounts. And remember, if you've got the granular, it's kind of harder to keep it out of the way of dogs. But just to tell you, if you are looking for the least expensive way, you can use the granular xylitol. Don't dissolve it in water. Don't do oil pulling with xylitol. Just eat a little bit at the end of every meal, at the very end of the meal, and then mouth rest.